EMT questions and answers with explanations practice test, 35 critical questions. Question 1. What is the legal term for providing care without consent? Negligence, battery, abandonment, slander. Touching a patient without consent is legally considered battery. Question 2. A 45-year-old male is found unconscious and alone. You provide care under which type of consent? Expressed, informed, implied, verbal. Implied consent assumes an unconscious person would want life-saving care. Question 3. What are the signs of Cushing's triad in head injury? Hypotension, tachycardia, tachypnea, hypertension, bradycardia, irregular respirations, fever, rash, neck stiffness, altered mental status, nausea, vomiting. Cushing's triad indicates increased ICP, widened pulse pressure, systolic HTN, bradycardia, and irregular breathing. Question 4. Which heart rhythm is most commonly associated with sudden cardiac arrest? Sinus rhythm, ventricular fibrillation, atrial fibrillation, first-degree block. VFib is the most frequent shockable rhythm in out-of-hospital cardiac arrest. Question 5. When should you stop CPR? When you are tired. When a bystander asks. When the patient is transferred to equal or higher care. After 5 minutes. CPR continues until ROSC, exhaustion of the rescuer, or transfer of care to higher medical authority. Question 6. A traction splint is used for which injury? Pelvic fracture, midshaft femur fracture, ankle sprain, humerus fracture. Traction splints are specifically for isolated, midshaft femur fractures without other joint injuries. Question 7. The golden hour in trauma care refers to the first 60 minutes after injury, the time spent in surgery, the drive to the hospital, the duration of the shift. Optimal outcomes occur when definitive care is reached within 1 hour of injury. Question 8. What is the standard dose of aspirin for chest pain? 81 mg 162 to 324 mg 500 mg 1000 mg. 2 to 4 baby aspirins, 81 mg each, are chewed to prevent further clotting. Question 9. A patient with high blood sugar, fruity breath, and small respirations likely has hypoglycemia, diabetic ketoacidosis, DKA, stroke, heart attack. DKA causes hyperglycemia, ketosis, fruity breath, and compensatory deep breathing, small. Question 10. What is the rule of nines for an adult's entire right leg? 9%, 18%, 4.5%, 1%. Each leg represents 18% of the BSA in an adult. Question 11. Which of these is a late sign of shock? Tachycardia, hypotension, anxiety, cool skin. Hypotension indicates decompensated, late, shock. Question 12. How do you treat a sucking chest wound? Pressure dressing. Occlusive dressing taped on 3 sides. Leave it open. Suture it closed. A 3-sided occlusive dressing allows air to escape but not enter, preventing tension pneumothorax. Question 13. The Glasgow Coma Scale, GCS, measures which 3 areas? Eyes, motor, verbal, heart, lungs, brain, pulse, pupils, pressure, age, weight, height. GCS scores eye opening, motor response, and verbal response. Question 14. In an MCI, mass casualty incident, a patient with no pulse or respirations is tagged red, yellow, green, black. Black tags indicate deceased or expectant patients. Question 15. What is the standard ratio of compressions to breaths in one rescuer adult CPR? 15:2, 30:2, 5:1, continuous. 30 compressions to 2 breaths is the AHA standard for one rescuer adult CPR. Question 16. Which organ is most likely injured in a LUQ trauma? Liver, spleen, appendix, gallbladder. The spleen is located in the left upper quadrant, LUQ. Question 17. A transient ischemic attack, TIA, symptoms usually resolve within 24 hours, 7 days, 1 month, never. By definition, TIA symptoms resolve within 24 hours without permanent damage. Question 18. What is the first step in managing a patient with active arterial bleeding from an arm? Tourniquet, direct pressure, elevation, pressure point. Direct pressure is the first and most effective step. Tourniquets are used if pressure fails. Question 19. Nitroglycerin is contraindicated if the patient has used which medication recently? Aspirin, erectile dysfunction drugs, example Viagra, warfarin, Tylenol. Sildenafil and similar drugs can cause fatal hypotension when combined with nitroglycerin. Question 20. True or false, you should always remove an impaled object from the chest? True, false. Impaled objects should be stabilized in place unless they interfere with CPR or airway.